So thank you, Michael, for your reflections on the experience of providers. And I'm sure that much of what you've said this morning will chime with many people that have been listening to your comments. And I think I would just acknowledge that we have had a bit of a choppy relationship over a few weeks, but I know that we are all really on the same page in recognising that the funding around adult social care needs to be sorted out and sustainable if we're wanting a market that does deliver the services and help and support that people deserve. And of course, you know that around housing, I share your passion around thinking about the sorts of offer that we make to people, and the current housing offer just isn't sufficient. And I know that James, as president, is also very keen to work around housing. And Kate's nodding at me because this is a big issue for you as well and for your family. So before we move on to questions, and you'll be pleased to hear there's loads, so you've obviously been chiming with the audience, all of you. If I could just have a few slides which talk about where ADASS is reaching. So thank you. And I think the first thing we want to say, and I think James probably mentioned this and Stephen yesterday, is that we really feel now it's time to have a big public conversation about how we design a system that enables people with care and support needs to live a good life. And what I would say is that social care has been very prominent, hasn't it? And I know that many people don't understand what social care is about. And I think we've got a great opportunity now to build on the fact that more people are more aware, and that we really need to be clear about what it is and what the offer is, so that we're clear about what we expect of individuals, families and fellow citizens and communities, and the state as part of a network of support. And I think that's what I've been hearing from the contributors this morning in terms of, we are all in this together, and how can we be collaborative and work in partnership and not in opposition. Can I have the next slide, please? So, when we think about the care we want, what ADASS is saying is that we want a complete review of how care markets work and the suitability, sufficiency, sustainability, social value and quality of provision, with a consideration of regulation. And again, Michael, in particular, you were making this point about needing to consider regulation and maybe legislation. And I think that does chime with the thinking so far within ADASS, and this is what we're wanting to test out with our membership through this seminar, but also in our other forums about, how do we want to move forward together. And can I have my next slide, please? And, the workforce. Eileen, you mentioned parity of esteem, and, it's really reflected, isn't it, in terms of how people are paid. So we think that we would want to see not only a workforce strategy, and it's telling that there isn't a national one for adult social care, but fair national care wages, training and career progression, and together with a greater support for informal carers and for families, I would add as well. And, I think we need to celebrate the people that work in social care and encourage that as somewhere to work. It's a great career, and, if it spans health and social care, wouldn't that just be great? That we are offering good and sustainable careers for people who've got so much to give. So I think that was my last slide. So I think I'm able now to take us into questions. So as we move to the questions, I think the first question is from Steph Lunn, who asked, do we need, even when people do live in the caring community with people of their choice, conflict can arise. What can we do to support people's networks in times of trouble? And perhaps if Caroline and Kate would take us through that, or give us your views.
I can't read that question, Julie. Would you mind repeating it, please?
Certainly. Even when people do live in a caring community with people of their choice, conflict can arise. And what can we do to support people's networks in times of trouble?
So I'm sure Kate will have more to say about this than I do, but I mean, conflict is part of living, isn't it? I mean, we all experience
Yes.
conflict. So I suppose my immediate response is we certainly can't get rid of conflict. There is something about making sure people are really well connected, have good networks of support. Kate, do you want to add anything to that? I'm not sure what type of conflict is referring to, so.
Yes, I don't know what kind of conflict the questioner is talking about, but maybe when we look at the kind of support that people have, so the actual face-to-face care workers who are supporting people, I think we don't necessarily value the right things. So I've got PAs who say weren't very good academically at school, but they have emotional intelligence in spades. So there's something for me around the support people have, that they really understand people as individuals and the things that are happening that cause them to create the conflict, and helping people to work through it. So maybe that would be something that I'd look at.
Thank you. The next question is one for Kate, and it says, will the new strategy include how we can work in partnership with CQC with services that fall through the regulatory net?
Thank you, Julie. So there is a conversation happening now. There's something called the sunset clause, which gives us the opportunity to ask ourselves, are the right things in scope for regulation? So I know when I arrived here a year ago, I started a conversation about day services. So if I think in my previous life as ADASS, if I think about the complexity of people who are supported in day services these days, it's quite different from someone who pops along to a local luncheon club. And I pose questions such as why on earth wouldn't day services be part of what we would regulate? So there's an active conversation about what should be in scope for regulation. We are interested in people with care and support needs. So in addition to being able to regulate services that are in our powers, we also have something called our independent voice ability. So our state of care report that we publish annually, but other publications such as restraint, seclusion and segregation, our recent publication about sexuality, we have the ability to talk about people's experiences of health and social care that aren't necessarily regulated through our independent voice work. So I would be happy to have conversations with colleagues about that.
Thank you. Michael, do you want to offer a view?
No, I think I'm pretty much on the same page as Kate said, yeah.
Okay. Lovely. Eileen, we have a question from you that's coming from Claire Barsham. Is there work underway to understand the excess of deaths reported by home care providers in the CQC survey published a couple of weeks ago?
I believe there is at Public Health England. I think they're looking at that alongside the ONS definitions of debt. What the timescale is and when they'll report, I'm afraid I don't.
Okay, thank you. But from what you were saying earlier, there is quite a lot of research underway, so we will have a good evidence base to understand actually what has been happening through the weeks of the pandemic. I think we will all look forward to receiving that. That would be good. And then I think really a question probably for Michael from Richard Webb, who's saying, do we need a more ambitious accelerated model of housing with care and technology and a goal to either replace residential nursing care or have a hybrid?
I mean,
a cheeky question.
You might be surprised that I do have an answer to that, an opinion, and obviously yes is the answer. I think what's really interesting in some of the work we've done is that if you look at the care home market today versus 35 years ago, talk to someone who ran care homes in 1985 and they'll tell you that people who, in their residential care homes, that if you needed incontinence pads, for example, you probably need to go to a nursing home. And, people who are in nursing homes today, 35 years ago, they would have been in geriatric hospitals, of which in the mid-1980s, we still had between 50 and 75,000. I think it was about 45,000 in 1987. So the nature of the care home market has really shifted, and the average length of stay has come down extremely considerably. At the same time, we're living for longer and longer. And actually what's interesting, and that's part of that regulatory gap, is that if you want to build a care home today, it's quite simple, because you get a piece of land, there's a planning category for care homes, funders understand it. CQC, I think, regulates care homes very well, and that's understood, and that's all fine, and you can go forward. Now you come and say something, I want to build something where care is optional, where kind of initially maybe 30 to 50% might use care services, or maybe some of them on an occasional basis. Planners don't know what to do with it. Funders don't know what to do with it. There is no regulation on the consumer regulation aspect of it. Other countries have housing retirement villages acts and these kind of things. We don't. So there's a real effort here that we need to make to actually make that sector grow, because it is the missing link that complements care homes, which really cater for very high needs and very kind of frail people. And this is for the people that are the 6 to 8 years in between people potentially needing that, although most people do not move on. The problem we have, just to finish off, is that DHSC, which is very interested in that housing with care model, actually has very few levers to pull, because planning policy, competition policy, and those issues sit with BEIS and MHCLG. So the problem we have is that we're kind of falling between different departments, and that's the work we're currently doing. So anyone who'd like to discuss that further, I'd be very interested. And certainly, Julie, you've been very interested in this in the past as well. And it's certainly the fastest growing part of this sector, with there's a lot of investors lining up a lot of money to go into that thing. So it's an exciting space to be in.
Julie,
it is, I think that yes.
I just think this, just very quickly, this goes back to, I think, your comment about this need for a big public conversation. I think now really is the time to explore new models of care, including residential and nursing care.
I think you're absolutely right, and I think there is an opportunity for us now to actually take a really big step forward. I think probably the last question is for the panel as a whole. So it's from Steph saying, do the panel think that people who volunteered during the pandemic can provide some of the caring about that is needed? And can this resource still be mobilised? I don't know whether you can answer about the mobilisation, but we have seen, haven't we, thousands and thousands of people volunteer through that NHS volunteer line, but also locally. I'm sure every colleague listening in will have been overwhelmed with the number of people wanting to help in their local communities. So what does the panel think? Kate, shall we start with you?
I think there's something about how we hone that goodwill and how we talk about social care as a profession. So we know if you've got the right values, the right attitudes, you can become a fantastic care or support worker. So I would be interested in those people who have volunteered, those people who maybe no longer have jobs in retail or hospitality, to be really clear, if you've got this sort of these sorts of skills around empathy, around empowering and enabling others, then social care is the profession for you. And then that needs to be matched up with that pay, reward, recognition, and career structure that I think we're all keen enthusiasts of.
Thank you. So, Kate Dipthorpe, it'd be interesting to hear your views on this.
Yeah, I mean, for me, it's been really heartening to see so many people out there, and where I live, I've had a sense of community that I really wasn't aware of before. And I don't know the answer. I would really like us to capture it. I suppose I'm worried that a lot of people are going to be going back to work and won't have the capacity to help and get involved in the same way. But I would like I'd like us somehow to sustain that sense of community through sort of more voluntary stuff and just connecting in the community somehow. I haven't got an answer. I just would really like it to continue. sort of to keep making connections and creating spaces. Yeah, I think sometimes what we don't do is create the spaces where communities can come together and have the opportunity to generate stuff where you don't know what the outcome's going to be, but create spaces for people to get together and ask people what they want.
Thank you. Caroline?
Yes, I think this is about investing in people and communities that I mentioned earlier. I mean, we to use awful jargon, we talk a lot about asset-based areas, and really that's what it's about. It's about bringing together the formal and the informal, pooling all of those incredible resources, the incredible wealths, the different strengths and wealth that we have. So yes, I think Kate's right. We do need to think about how we build on this, but it is about investment. I don't think this is just about I don't think we can rely on everybody's goodwill. Everybody's going to burn out. There is investment needed in this.
Thank you. And Michael?
Well, just 3 brief points. One is, I think the volunteering spirit, what really worked, I think, was an ultra-local approach to this. And I think the people on our street, we identified pretty much everyone over the age of, everyone who was shielding or vulnerable, probably within about 2 or 3 days. Like, there was WhatsApp groups, there was leafleting going on, and I think that worked extremely well in terms of how just, local communities work together. And that was something I think hopefully we can harness. In using volunteers in services, we have a number of members who do that very well. I am a bit hesitant to say that let's get more volunteers to do jobs that we should actually be paying for. And I think that's both Kate from a kind of regulatory point of view. I think there's a tricky one there. There was an issue during the pandemic of, basically providers locked down their schemes, and that was for infection control purposes. There was a problem there. You couldn't really let that many people in, but hopefully we can get that longer term. And the third point is, I think it's important to forget that one of the things that we really saw is that actually people using services helping each other, or like certainly the residents that we saw in retirement communities, extra care housing, retirement villages, it's more of an enabling model, so people are less frail, and actually they looked after themselves to a huge degree, that they had support groups, they were leafleting each other, they were kind of doing like playing musical instruments and things, and looking at harnessing that in that thing of not just what can we do for people, but how can we help them to actually kind of be part of their communities as well. And that partnership approach with people using services is something we should really try and harness out of this.
Thank you. And Aileen, we'll give you the last word on this.
Yeah, and I think the volunteering effort and the spirit of altruism, that sort of thing, is great. And I don't want to sound like a big glass of cold water from a perspective, but I worry about sustainability of public services if volunteers are seen as, I think they should always be additional and seen in that way. And I think the other thing to bear in mind is that they take managing, and they take managing in a different way. So one has to have the management resource to be able to do that. So apologies if I'm being oddity about the whole thing, but those are my views.
No, I think you've all given very wise words in reflecting on that, on the use of volunteers and the potential. So, colleagues, we're coming to the end now of what I think has been a very interesting discussion, and I think sets us up for the rest of the conference, really, when we talk about what do we want adult social care to be like by 2030. And I think we'll build on the conversation that we've had this morning. So a big thank you to Kate and Caroline for reminding us why it is that we're here, and what some of the things that we have to consider, and for reflecting back to us how it's feeling and what we might need to do differently to, I'm going to say the word improve, sorry, but to have a better experience and to help people live good lives. Thank you to Kate from CQC for talking about what you've seen. And I was really heartened to hear you say, actually, when you did inspect or visit services, it wasn't anything new. It was the same issues that we're dealing with outside of the pandemic time. And really, thinking about being very open in terms of how you're approaching regulation, but how you're also approaching working in collaboration with providers, with councils and other partners to try and improve, again, I'm using that word, but to think about the quality of what's actually being delivered. And Aileen, as ever, you're just great, and I just love how you approach the evidence and the intelligence, and the number of conferences I've been at over the years where you've just said, actually, this is how it is. And, you know, as a jobbing director, I've been thinking that, but then having someone from the National Audit Office sort of making those points and saying, actually, this is what's been going on. No, I think that's really, really helpful. And Michael, you know,
Thank you.
We are in this together, aren't we? We are generally on the same page, and your thoughts about how we might move forward and, you know, drawing the distinction between some of the national direction, particularly through the NHS and the health service, and then reminding us that just how much more tricky it is in terms of social care. And yet, you know, together we've got a bigger workforce in the NHS, and it's beholden upon us, you know, to remember that workforce and to remember that we're here, you know, to represent that workforce, but at the same time to think about what it's for and how it's going to move forward. So many, many thanks, and I'm giving you a virtual clap on behalf of the conference.